I have the privilege of seeing the teams of people who show up each and every day and who go above and beyond to care for millions of patients. While our teams in Ontario's healthcare facilities are tired, their resilience and dedication to patients and their families is inspiring. It takes special people to work in healthcare. Whether they are at the bedside providing direct care, working in a lab, scrubbing floors, or supporting our teams, everyone is focused on a singular goal: providing the best care possible. I know we are in some choppy waters right now, but there are reasons to be optimistic. At Sunnybrook, for example, we've been fortunate to work with groups of clinical externs who have been mentored in a program where students are brought to get hands-on experience as they progress through their education. Since the inception of the program less than a year ago, we've hired many of the clinical externs as full-time nurses once they graduated. We've also mentored nurses who have been educated internationally, and we're working with them to help them become certified to practice in Ontario. I'm delighted that some of our Sunnybrook team who came through the extern and internationally educated nursing program are here today. So, yes, we are challenged currently as we navigate through a generational healthcare issue, and we need to build our system back up to be stronger than ever. Our students, staff, and all of our team members give me hope for the near future. Driving through adversity takes great leadership. When things are most challenging, you keep going. As somebody once said, a pessimist sees the difficulty in every opportunity, and an optimist sees the opportunity in every difficulty. Leadership takes optimism and a plan. So I'm very pleased this morning to introduce you to a fellow optimist and a tremendous leader who will help steer a path out of this situation for Ontario. Please welcome the Honourable Sylvia Jones, Minister of Health and the Deputy Premier.
Well, thank you for that kind introduction, Andy. And thank you to the entire team here at Sunnybrook for providing exceptional care to your patients. You have been an instrumental part of Ontario's pandemic response. Our entire government is so grateful for the extraordinary efforts of the province's healthcare workers, the paramedics, nurses, public health workers, doctors, personal support workers, and so many more who have shown incredible perseverance, dedication, and sacrifice to provide exceptional care to Ontarians. Thanks to the efforts of so many people and organizations, as well as Ontario's cautious and phased approach to reopening, Ontario has fared better than most other jurisdictions. This is also in part thanks to our March 2022 plan to stay open. This plan is filling gaps in 3 main areas, including expanding the province's health workforce, shoring up domestic production of critical supplies, and building more beds. This plan is already in motion, adding thousands of healthcare workers into Ontario's workforce, giving personal support workers a well-deserved permanent raise, giving Ontario's nurses a $5,000 retention bonus, and building brand new medical schools, and paying for aspiring nurses textbooks and tuition if they want to serve in underserved communities. That brings us here today. Over the past few weeks, we've been actively engaged with frontline partners, hospitals, long-term care, and union leadership, and our best experts to identify concrete and actionable solutions to respond to urgent pressures, as well as prepare for any expected surge in the winter months. The second phase of the plan to stay open we are introducing today is the culmination of those conversations. Our goal is clear: provide the best care possible to patients and residents while ensuring the resources and supports are in place to keep our province and our economy open. This is a 5-point strategy to further bolster Ontario's healthcare workforce, expand innovative models of care, and ensure hospital beds are there for patients when they need them. Our plan includes action in 5 key areas: preserving our hospital capacity, providing the right care in the right place, further reducing surgical wait lists, easing pressures on our emergency departments, and finally, further expanding Ontario's health workforce. As the actions in this plan are implemented, Ontarians can expect to see faster access to health care, including lower wait times in emergency departments, lower wait times for surgical procedures, and more care options in our communities. This next phase of our plan to stay open will add up to 6,000 more additional healthcare workers. Combined with the initiatives, including the first phase of the plan that are adding 1,300 additional staff, the two plans together are adding 1,900 more healthcare workers, including nurses and personal support workers, into Ontario's health workforce. The plan will also free up and make available over 2,500 more hospital beds on top of the 3,500 the province has so far added, so that care is there for those who need it and the province can stay open during an expected winter surge. We are working with the college to reduce financial barriers that may be stopping some retired or internationally trained nurses from receiving accreditation to resume or begin practicing by temporarily covering the cost of examination, application, and registration fees. We are also aware that nursing agency rates have increased significantly, creating pressures for hospitals, long-term care homes, and emergency departments. These agencies have always been a tool available to aid hospitals when dealing with staffing pressures, now more than ever. In light of this, we will engage with our frontline partners to better understand how we can bring stability to hospitals and emergency departments while protecting quality of care. Despite the challenges of the pandemic, the Ontario government has made significant progress to improve the healthcare system. Ontarians should be reassured that they can continue to have access to the care they need when they need it. In the face of some of these increased pressures, we know that even more needs to be done to improve patient care and support our healthcare workers. We can no longer accept the status quo. And there are some who will fight for the status quo no matter what. They're ideologically opposed to change or improvements. We won't accept that. We can't accept that. People want better health care. We need to have the courage to look to other provinces and countries to understand how we can improve and learn from them. Shorter wait times for emergency services and surgeries. Better quality care that takes the guesswork out of navigating a complex system. More virtual and digital options, including for people receiving care at home. We need to be bold, innovative, and creative. And we need to be clear. Ontarians will always access health care with their OHIP card. Today's plan to stay open will provide the support our system needs to address urgent pressures and prepare for a potential winter surge. We are not done driving improvements to care. We will continue to engage with our frontline partners, experts in their field, to imagine and implement a future that improves the care we provide to the people of Ontario. That's our promise to you. Thank you. Merci. Stay well. I will now pass it over to Minister Calandra.
Thank you, and good morning, everybody. Thank you, Doctor. Thank you, Minister Jones, Matt, and of course, a very special thank you to all of you. It is very good to be here with you all today for this announcement. The plan to stay open will ensure that Ontarians continue to have access to the health care they need and deserve. And long-term care plays a critical role in our plan. That's why, to support the stability and recovery of our health system, we're moving on a suite of permanent changes that will ensure Ontarians are getting the right care in the right place, while avoiding unnecessary hospitalization. Some of the measures include investing $37 million this year and $62 million annually going forward to expand access to a range of services and supports for long-term care residents with more complex needs like bariatric, behavioral, and dialysis. Freeing up over 1,000 long-term care isolation beds for regular use to help reduce the long-term care wait list. Reintroducing short-stay respite and convalescent care beds in long-term care to support patients in an appropriate care setting. Now, as part of this suite of actions, I'm proposing amendments to the Long-Term Care Act later today. No one wants to stay in a hospital longer than they have to. However, there are unfortunately those patients who doctors say no longer need to be in a hospital but can't go home either because they require additional care. These amendments, if passed, will make it easier to temporarily transition these patients into a long-term care home where they can receive more appropriate care in a more comfortable setting while they wait for a bed available at their preferred home. We're going to be consulting with agencies and our frontline partners on a consistent placement guideline that will ensure patients continue to stay close to their partner, spouse, loved ones, and friends. We will also ensure that no one is out of pocket for any of the cost differences there might be between the temporary home placement and the cost they would have been paying in their preferred home. By providing the right care in the right place, these policies will move 2,400 ALC patients to long-term care beds at maturity. Because, as always, our priority is for people to live and receive care where they can have the best possible quality of life, close to their family and friends. The proposed legislative changes, in combination with the other actions in our plan, will help to ensure that our healthcare system remains stable and strong. Now, we also continue to move forward with our fix to long-term care. You all know that we've committed almost $5 billion over 4 years to help long-term care homes hire more than 27,000 additional frontline staff. We've invested over $6.4 billion to build 30,000 new and 28,000 upgraded long-term care beds. And we've already reached and, in fact, surpassed both of these goals with over 58,000 new and upgraded beds currently in the development process across the province. By building homes, strengthening staff, and responding proactively to system challenges, we're doing what needs to be done to ensure the healthcare system is stable both now and in the future. We're doing what needs to be done so that Ontarians continue to receive the care they deserve, the care that they need. Thank you very much, and again, I'll turn it over to you, Doctor.
Well, thank you very much, Minister Calandra, Minister Jones, and that concludes the remarks, and open it up for questions.
Good morning. We have a scrum mic on the right-hand side for anybody not currently in line. As a reminder, it's one question and one follow-up. Thank you.
Good morning. This is for Minister Calandra regarding long-term care.
Good morning.
Good morning, Minister. So this is causing quite a lot of concern amongst people who have loved ones waiting for a long-term care bed who might be in hospital. We know there are almost 2,000 in hospital beds that should be in long-term care right now. If somebody is really opposed to this, is the hospital going to force them to leave? How are you going to handle that?
Yeah, look, ultimately, what we're doing here today is ensuring that somebody has the best quality care in the right place. What this allows us to do is start that conversation with a patient, a resident who is in a hospital in the ALC. Start the conversation. It allows a clinician and the long-term care placement coordinator to speak with the family, but continue down the path of placement into a long-term care home once the journey in a hospital has concluded for them. Ultimately, no, we are not going to be forcing anybody out of a home, but the changes do or out of a hospital, excuse me, but the changes do allow us to continue that conversation, to explain to the to somebody who is in a hospital why their needs can be met in a long-term care home. Look, we're not removing anybody from the priority waiting list. They're going to continue to have access to the priority waiting list. We're going to be working with the sector to ensure that people who are moved into a long-term care home are close to their family, their friends, and to help them understand that the best quality of care for them once they've completed that journey in a hospital is in a long-term care home, and that there are other patients who need access to those beds.
But doesn't that already happen now? And is this just this new legislation giving you the stick to make sure it does happen and that they actually have to move? Because we know hospitals do say to people, you've got to get out. And we know some have already been moved further away than they want. So are you now enacting a stick so that it is more effective and that you can use it?
No, the legislative changes allow us to continue the conversation as opposed to cutting off the conversation. It allows us to continue that conversation. It allows the long-term care placement coordinator, the hospital discharge officials to work more closely with the patient in hospital so that we can transition them from an acute care bed into a long-term care bed. Look, I know this is a challenge. It's going to be a challenge for many people. And that change is always difficult, but we've made significant investments in long-term care. There is a challenge in acute care, and long-term care is in a position to make a difference for the first time in generations.
Lorenda Redekop with CBC News. This is a question for Minister Jones. Last Friday, I asked the Premier about agency nurses, and he said that he couldn't control what a private company is doing. I see the last paragraph of your announcement says stabilizing agency fees. So what's changed?
So I think that there is absolutely an acknowledgement that there has been more use of agency nursing. Having said that, we've always had agency nursing in the province of Ontario. Hospitals and other community organizations have used them to deal with surges that happen perhaps over the winter flu season. So they have been in existence, and they are part of our hospital continuum and our healthcare continuum. We are seeing more and increased use of agency nursing, and we want to have those conversations to make sure that, frankly, we don't do something that unduly impacts another part of the healthcare system. You'll notice with today's announcement that there are pieces that include all aspects: community care, long-term care, hospitals. We understand that you can't put pressure on one and not impact other sides, and that's what we're doing in the same way with the agency piece. We'll have those conversations to make sure that there isn't a undue use of agency nurses, but I will say again, reinforce that agency nursing has been in Ontario and used as a surge protector for many years.
So it sounds like you haven't worked out the details just yet. One of the things that we keep hearing about nursing and from the nurses union, and I know you guys are opposed to this, is repealing Bill 124. And you always bring up that you have given this $5,000 bonus for nurses. They're asking for more. It hasn't kept many nurses from leaving the profession. So why won't you, allow a larger wage increase at this time when we're seeing this huge increase of nurses going to these agencies?
So, I think it is important for us to remember that our government has acknowledged that this has been a very challenging time for nurses and healthcare workers generally through the pandemic. We've acknowledged that through the personal support worker, initially temporary wage enhancement that of course now has been made permanent. We have acknowledged that through the $5,000 nurse retention program. There are other programs in place that we are doing, nurse offload, dedicated nurse offload program, for example, to assist in our emergency department. We've worked very hard to understand where we can assist our healthcare partners and give them the resources they need, because frankly, that's what the people of Ontario deserve.
Hi, Mr. Jeff Gray, Globe and Mail. I wanted to ask about some of the language in the report about reducing the surgical backlog. It says a couple times that you're committed to using existing private clinics and having more surgeries go to those clinics. So are you also contemplating lifting what I understand is a legislated cap on the number of private facilities, such as Shouldice, which you and the Premier have mentioned, to allow more of those to be set up in the province?
So again, I will reinforce what I said in my remarks. Healthcare will continue to be provided to the people of Ontario through the use of your OHIP card. We see the value of having some of those independent health facilities that have existed in the province of Ontario for literally decades to take some of the pressure off of our healthcare partners. And many of those independent health facilities have arrangements and work directly with their local community hospital to make sure that they are providing the services that are adding the greatest pressure. I don't know, Matt Anderson, if you wanted to speak a little more in detail to that?
Thank you, Minister. Just reinforce that. We are working with existing facilities. Our goal, of course, is to stay focused on the wait list and to do this in an integrated fashion. And most important for us is, as we think about these services that can expand and can speed up reduction in our wait list, also doing it in a coordinated fashion where we're not pulling staff from the public system into the private system. So we have to balance that as we go forward. There's certainly an asset there that we can leverage to reduce our wait times, and we're certainly exploring what we can do with that.
And just to follow up then to the Minister, maybe just to get a clear answer on that. are you committing then to not lifting the cap on the number of places like Shoaldice that can be set up in the province? Yes or no?
What I'm committing to is continuing to work with hospital partners, independent health facilities, and healthcare professionals who see where the opportunities are, whether that is existing capital that can be used more. A very obvious example, of course, is we have given hospitals additional funding to allow their to allow their surgical suites to be able to operate for longer during the course of the day. Those are types of things that the capital is there, the infrastructure is in place, and with a small investment from the provincial government to assist on the health human resource, we are able to actually deal with the backlogs and the access. Because, you know, at the end of the day, this is about ensuring that when you need that surgery, when you need that diagnosis, it's available to you and you're using your OHIP card. Thank you.
John McGrath, TVO. We've talked about access through the OHIP card. Are you committed to maintaining the prohibition on extra billing that has existed for many decades in this province?
There are no conversations about extra billing.
When this government previously made measures to move people out of long-term care homes, sometimes to not their preferred locations, that was a response to the pandemic. That was a COVID measure. The fact that this is now being implemented again or in a modified form, is that not an acknowledgement that COVID is still not under control in this province?
I think that what it shows is the investments that we've made, the commitment that people of Ontario have made by getting their vaccine and keeping their vaccines up to date is showing that we are able to protect the people of Ontario. And of course, our most vulnerable are our loved ones and seniors. So when we have those protections in place, it allows us to, for example, we no longer need the isolation beds because people have the vaccines, because we understand more about how the pandemic has impacted us. We have put the HEPA filters in place to make all schools, hospitals, long-term care facilities safer. And all of those pieces together mean we are in a very good place today to be able to say, you are most appropriately going to be looked after in your community long-term care facility and bed. That is a home for you to go to. We want people to be in the best place, and in this case, we have alternative level of care patients who really don't need to be in a hospital. And I would suggest to you that it is much more appropriate that they are in a long-term care facility that has the programming, that has the infrastructure in place to serve them in their homes. Thank you.
Minister, good morning. It's Richard Southard with City News 680. You and the Premier have said repeatedly recently that your government has added 14,500 nurses since 2018. I'm wondering, do you know how many nurses have left the profession just within the last year? Do you have any numbers on that?
I do not, and it's frankly because it is nursing and nurses writ large are in a lot of different facilities. So hospitals, you could track the numbers, long-term care, we have them in community, we have them, remember we made a commitment of 600 nurses in our public school systems. So there are nurses that are practicing in so many parts and of the healthcare system, it would be very challenging to see all of those numbers together. I will say that my conversations with Catherine Hoy and Doris Greenspun, they often highlight what can we do more to ensure that those mid to late career nurses are giving everything that they can to assist their system. We have a lot of new, young, eager professionals coming into the system, and we really want to ensure that the mid-late career nurses are there to mentor and to be part of the solution.
You say your plan today, I think it was you're going to open up 2,500 new beds as a result. Where are the nurses going to be to staff those beds? Are you confident you're going to have enough nurses, Minister?
So I'm going to turn that over to Minister Calandra because there are, well,
Yeah, a really good question. Obviously, as we as we open up the long-term care system. I just want to say very clearly, the challenges in acute care have been a problem in the province of Ontario for a very, very long time, but long-term care has never been in a position to play a role like we are now, and it is due in large part to the investments that we've been making. With respect to movement from ALC into long-term care homes, no long-term care home that isn't able to accommodate or provide the appropriate level of care for somebody who's leaving ALC into a long-term care home will be admitted into a home. That is a fixture of the Fixing Long-Term Care Act, and that does not change.
Hi, this is a question for Minister Jones. Liam Casey with the Canadian Press. Minister, which part of this plan will help the nursing staffing crisis immediately?
Immediately, the fact that as of today, I will be receiving plans from the Ontario College of Nurses and the College of Physicians and Surgeons of Ontario saying how they intend to expedite individuals who have applied for and are waiting for accreditation and licensing in the province of Ontario.
And following up on Richard's question, in the document it says that additional 6,000 healthcare workers are going to be hired. How many of those will be nurses, and when will that happen?
We can get the breakdown for you, but clearly the investments that we've made in the Learn and Stay program, ensuring that nurses who are prepared to work and live in an underserviced area was very welcomed when we raised that with the Association of Municipalities of Ontario earlier this week. So that would be one example where we are ensuring that capacity can continue to be expanded. Of course, 2 new medical schools in Scarborough and Brampton is incredibly exciting news. We haven't had that kind of medical school expansion in decades in the province of Ontario. So there are many pieces that are part of this plan, and we're not done.
Hi, good morning, Minister. Yesterday, we reported on the mandate letter that your predecessor, Christine Elliott, had sent to the head of Ontario Health. This was in between the Delta variant and the Omicron variant, and one of the first things this mandate letter said was, we want you to identify and pursue efficiencies and savings, including those due to COVID-19 as applicable. Minister, can you help us understand why the Ministry of Health, during an unprecedented pandemic, would be telling Ontario Health to find efficiencies and savings in the healthcare system?
So Ontario Health has been a huge partner during the pandemic, working with the integration piece that is so critically needed. We talk about the expansion of Ontario Health teams in the province of Ontario. That at its core is to make sure that long-term care, hospitals, community care, hospice, all are working together, focusing on that patient. That has been the role and the focus of Ontario Health, which I would respectfully say they have done exceptionally well. It was to make sure that that integration of healthcare services happened. You know, before the pandemic, we didn't have hospitals who were talking to their long-term care community. We have that now in the province of Ontario. We have primary care physicians, we have paramedics who are working actively with their hospital partners, with their long-term care partners, to make sure that that patient is getting the care they need where they need it. Matt, I don't know if you wanted to carry on.
Great, thank you. Hi, Colin. And just a little bit of a repeat from what I said to you, Colin, before, and just for the audience here. Also, in addition to everything that the Minister has said, as we put things in place, we are always going to look to see what is best evidence, what is going to have the greatest impact. And our expectation is, as we identify those efficiencies, and as Mr. Jones has just described, that they get reinvested into the healthcare system. So we're making the most of every dollar that's being spent. And so we didn't see it as an odd thing that we were being asked to look for efficiencies as we move forward.
And back to the Health Minister, if you don't mind. So Mr. Anderson had told me this week that since its inception, Ontario Health has actually found about $500 million worth of savings, given it back to the government, and you've claimed that that has been reinvested back into the healthcare system. Going forward, is that still the expectation during what we're seeing in hospitals, a crisis, which I know you don't agree with the description of the crisis, but is the expectation for Ontario Health to continue to find efficiencies and savings specifically as we go forward?
The expectation for me is that Ontario Health teams expand and become very much the normal for patients and families who are navigating the healthcare system. I've often said, from initial assessment to treatment to, in some cases, palliative, all of those pieces have to be first and focused on the patient. We unfortunately have had in the past situations where that patient has to repeat their story multiple times. The specialist has to request the assessments and the records that have already been in place. We want to continue to work and strengthen Ontario Health teams across Ontario, because that's what is going to make a difference to that individual who is frankly going through one of the most challenging times in their life as they access treatment and deal with an illness that is frankly often very unknown and frightening for people.
Hi, Mirna Djukic for Radio Canada. I do have a question for Mr. Smith. Dr. Smith, and yeah, good morning. We heard from your own hospitals that the cost of the agencies has gone up from 4.5 to more than 8 million in a few years. What would be most helpful for you that the government could do to address those costs?
So first I want to start by saying, and I think the minister did say this, that we have for years had to a greater or lesser extent, work with agency partners as the minister said, a surge protector. But what is going to be the most helpful, and it's something that we've begun, and I believe there's an opportunity for us to continue to work with government to expand, is work on a multi-pronged approach toward bolstering the people, such as the people behind me here, who work on our teams and our teams in general. So programs like the Extern program, like the support of internationally educated nurses, like some other new creative ideas that are being developed with healthcare leaders in government right now. These are going to be the way out of it. We need to bolster our people and teams. Quite simply, we need more healthcare workers. And so the number one thing that's going to help us is government's ongoing support, which we've had and we expect going into the future, to be able to get more people more quickly to be part of our terrific teams.
I do have a follow-up for the minister. About the surgeries that could be done by independent facilities. I know you said you're exploring your options, but you must have some ideas of the types of surgeries that you're looking to expand. Is it cataract surgeries? What types are you looking into, and are some things off the table for this?
So obviously the places that we will go first is where the infrastructure is already in place. And we've seen that in emergency suites in hospitals across Ontario, offering and ensuring that they have health human resources to be able to expand the number of hours that are available for those scheduled surgeries. And, as I said, where infrastructure is currently in place, that is always going to be the fastest route to ensure that we can put more people through and get the services they need.
Sorry about that. Aidan Shmani with Queen's Park Briefing. On the moving long-term care patients thing, I'm just wondering, like, if there's an ALC patient waiting for a bed and one opens up in London, but there's a London resident also waiting for the bed, who gets that bed?
So what we're doing is we're going to be working very closely with the patient in the hospital system. We're not making any changes to the priority waiting list, both for patients who are in ALC in hospitals or those coming from the community. So that is not changing at all. What we're going to do, though, however, is continue these conversations with patients so that they understand that the best quality of care for them, once they've completed that journey, in the hospital, in the acute care setting, is in a long-term care home. These are people who want to be in long-term care ultimately. We have the ability to and the space in long-term care, and we have the ability to be part of the solution. So we're not changing the priority list. We're not taking patients who are currently in the hospital and moving them into and removing them from their choice of homes. What we are saying, though, is that while you wait for your preferred home, we want you to do that in a long-term care home, because we think that is the best possible place. That's where you're going to receive the best care once you've ended your hospital journey. And as I said, we're in a position now in long-term care to be part of the solution in a way that we have not been for decades. So there will be no changes to the priority list, both for the patient in ALC or those coming from the community.
And continuing with the LTC trend, sorry, one sec. Sorry, I'll pass it on.
No problem.
Good morning. I'm Edward. I'm the Queen's Park Press Gallery intern. My question is for Minister Jones.
Sure.
So the plan you released today includes promoting COVID shots and also flu shots as well to prepare for the surge in healthcare resources in the fall. One thing, though, is that kids are going back to school in the fall. People are coming back from vacations in the fall. Simply, more people are returning back indoors. So if the situation gets worse, is the province prepared to bring back mandates like mandatory masking in indoor spaces?
So we have always worked very closely and listened to the advice of the Chief Medical Officer of Health. And that advice is driven by information from hospitals, from public health units, from the science table. We'll continue to do that. And in my remarks, I mentioned, Ontario should be very proud of where we are at in terms of vaccination rollouts, and it's because we've listened to the health experts, we've responded and reacted to the recommendations they've made, and probably most importantly, the people of Ontario have said, I want to take ownership of my health care, I want to make sure that I can safely go to school, visit my loved one in a long-term care home and work, and to do that, I'm going to keep my vaccines up to date.
But are there specific metrics that the province is looking at? Because the situation is already really bad right now. So come the fall, what will be looking at, in terms of hospital capacity, in terms of staffing shortages, if people can't even access the ERs?
So again, I will reinforce that as our vaccinations have increased, the intensity and challenges that we had previously because people didn't have a vaccination or an option for a vaccine, we have seen those numbers very much stabilize. We are seeing currently that this wave has again stabilized and we believe is on the decrease, but I will reinforce, we have always listened to the Chief Medical Officer of Health and the experts and reacted and responded appropriately when necessary. Thank you.
All right, thanks everyone. I think we'll just do a quick group photo and then we are wrapped.